Good morning, YouTube family and friends. Hope you all had a great week. My week was, normal. Today is Saturday, April 18th, 2026. And yes, I am actually getting this out on a Saturday like I normally would supposed to do or plan. My goal is to. So yeah, I'm actually doing it on time this week. Yay! So let's see. I did ultrasound and a blood test on Tuesday, and then I had to follow up with the liver doctor Friday yesterday. And then I also had my monthly appointment with my psychiatrist. That and of course my weekly weigh-in. So I got a little bit to talk about today. It will be nowhere as long as last week. So, all right, we're going to start off with my weight. Last week, I weighed in on Sunday morning because I had gotten back late Saturday night from my cruise. And yeah, as a reminder, I don't like weighing in right away after getting back from the cruise because from the cruise and from the air flight, you can retain water and it just messes with your body. So it usually causes you to show that you gain weight where you really haven't. So, but anyway, last Sunday I had gone up 6 pounds to 199. Well, this morning I weighed in at 195. So 4 of those pounds came back off. So I figured it would. No, that's just what happens every time that I go on a cruise. So that puts me back at 41 pounds lost since being back on Mounjaro. So that's for 108 weeks. So that's good. Well, well, not according to my doctor. We'll talk about that here in a minute. So, all right. Let's first talk about my ultrasound results. Had to remember that. All right. I'm going to look at my computer screen over here, so don't mind me if I'm not looking at the camera. All right. Well, I think I mentioned this last time. My platelet count that was taken by the metabologist, it dropped again down to 110 from 113. And I've been on a slow decline on my platelet count. Back in August 18th of last year, 2025, it had dropped from like 165, I believe, down to 118. And then we had another test ran on September 23rd of 2025 and went down 2 more points down to 116. Mind you, it really means 116,000, but it's just easier just to drop the 3 zeros. So just say 116. And then on December 5th of 2025, it had dropped another 3 points down to 113. And then, of course, on March 31st, when I went to go see my metabolic consultant for the first time, and she ran a bunch of blood tests, it came in at 110. So another 3 point drop. So it's just on a slow, steady decline. That big one, 165, before the 118, we think that was just an anomaly. So, because the time before that, it was like 120 something, I don't remember. So we think that big one was where it actually was back in normal range was just an anomaly. All right, so from March 31st to this week, April 14th, that's basically 2 weeks. It had dropped 8 points. So my platelet count now is 102, which is just a little above that 100 mark. So that is scary. Excuse me. My liver doctor says, don't be worried about that. She says she's not going to start to be real concerned until we get close to 50. So even though initially she said, we hope to keep it above 100. Now that we're getting close to 100, now she said, as long as it stays, I guess at 50,000 mark, 50, that's when it's a real danger, because that's when it really can mess up my ability to clot my blood. So, but anyway, she says, try not to worry about that right now. And then one reason I'm worried about it is of course, I think I mentioned this last time, my protein, which is how long it takes for the blood to actually clot. It's slowly creeping up. It's still in normal range, but it's getting closer to that top of that normal range. I don't have that up, but it was, I think, 15.6 seconds. So that means that it took 15.6 seconds for my blood to actually start clotting. So, and so you mean you got your blood, the longer it takes for your blood to clot, on top of your platelet, you have less platelet counts in your blood. That's a bad combination, and that's a sign that your liver cirrhosis is progressing. So, yeah, not good for my anxiety at all. And then a couple of blood results that are now abnormal. My RBC, which is red blood cells, that's slowly creeped down below normal, not by much. It's now at 4.29, and the bottom of the normal range is 4.3. So normal should be 4.3 to 5.9, or 5.9, according to the place that did these tests. So I'm at 4.29. So just 0.01 below normal, which isn't right. It's right there. So, but my March 31st, 2 weeks ago, it was at 4.59. So it dropped in 2 weeks, 0.3. So, but I said that's been kind of hovering on the same dotted line, kind of. You think of a chart, little up, little down. It's just kind of hovering till this last one, where it's 4.29. It kind of dipped a little bit. And this is only my second time for that to be below the normal. Back near, it was between May, I think it's late May of 2025 is the last time it dropped. And it dropped down to about 4.1 or something like that. I'm just reading off the chart. I don't have the actual number for that. So, but anyway, so they said it's dropped a little bit. It's slightly below normal, but again, my liver doctor said don't try to stress over it. Then my hemoglobin, which is hemoglobin is an iron-rich protein in red blood cells that transports oxygen from the lungs to tissues and returns carbon dioxide to the lungs. So I got this pulled up on Google. Normal levels are generally 13.8 to 17.2 for men, and then 12.1 to 15.1 for women. Low levels cause anemia-related fatigue, while high levels, often due to smoking, dehydration, or lung kidney disease, can cause dizziness, headaches, and thickened blood. Well, mine is low, so that means I stand a risk of anemia-related fatigue, which I said I'm extremely fatigued all day, every day. It came back as 13.4 on this week's test. And then on March 31st test, just 2 weeks prior, it was 14.2. So it was above normal. And now it's dropped to 13.4, which is just slightly below the normal range of 13.5. This testing place has normal as 13.5. Google has it at 13.8. So again, it's dropped down below normal, and it's only been below normal one other time. Again, that was on that May-June testing, so same as the RBC timing. So yeah, so that's the blood test. And I said my liver doctor knows that I suffer from bad anxiety because of all my medical issues. So I talked with her a long time. She really tried her best to ease my mind, and I'll go over that here in a minute after I go over my ultrasound results. So here's the impression that was stated for my ultrasound results. This is from the reading physician who read the results of the ultrasound test. Okay. Number one on the impression says cirrhotic morphology without acute abnormalities. So that means I have the cirrhosis and it has scarring on it, but there's no abnormalities, which means there's no lesions or anything like that to say that they gave any indication of cancer or just anything. Oh, went down a little bit of my saliva went down the wrong pipe. Heat that. All right, and then the number two impression was stable, mild splenomegaly. I don't know how to pronounce that. Splenomegaly, suggesting portal hypertension. Means an enlarged spleen. That's basically what it means, but it's just mildly enlarged at this point. It's been mildly enlarged for quite a while. Then, of course, it says the reason for the exam is NASH cirrhosis, which is what I have, hepatocellular carcinoma surveillance in a 49-year-old male. So that means we're also looking for any development of cancer in the liver, basically, especially in the scarring. So this discussion points on here. It says ultrasound evaluation of the abdomen was performed and a comparison is made to prior ultrasounds dated 10/1/25, 4/11/25, as well as a CT scan dated 11/13/23. So they always take a comparison to prior ultrasounds if they have them, just to see where it was at before. So, and here's what else it stated. It said the gallbladder is normally distended and there are no calculi. The gallbladder wall is not thickened and there is no biliary ductal dilatations or pericholecystic fluid. These words. It says the patient was not tendered to ultrasound transducer palpations over the gallbladder. So pretty much means my gallbladder looks good. Okay, next is the liver is normal size, measuring 15.1 centimeters, and has a nodular contour with a mildly increased inhomogeneous echogenicity and no focal abnormalities / mass. So basically my liver shrunk, which is scary because as the cirrhosis progresses, the liver will start shrinking because my liver size back in my October ultrasound showed it as enlarged. It was 17.6 back then, so it dropped 2.5 centimeters. So that, yes, back in the normal range, and that could be good, or that is another sign that it could be progressing. So we have several signs of these that is showing that there's a good chance my liver cirrhosis is progressing. So, okay. It also says the portal vein is patent and displays hepatopedal flow. The hepatic veins are patent and have normal color Doppler imaging characteristics. What that doesn't mean is it doesn't mean that my portal vein hypertension has gone away. That has nothing to do with that. It just says that the blood in the portal vein is still flowing. It's still flowing into the liver. It doesn't show restrictions to the flow, like it's slowing down because of the hardening of the liver, causing the blood flow to back up. It doesn't show that. It just shows there's blood still flowing into the liver. But as I said, it doesn't measure how fast it's flowing. So that would be nice to know, because if we have the rate of the flow, you would probably see that the flow rate is decreasing, causing the blood to back up. So even though it's still flowing, it is somewhat restriction, kind of like restrictions. Though as the blood flows into the liver, less of it is flowing in at a time because the hardness of it. So it's causing a backup back here, like traffic jam. Now, as the traffic jam happens, more and more cars get backed up behind it, and that's kind of like your liver, portal vein, spleen. So as the blood starts to back up, traffic jam backs up, blood starts to kind of pull more into the spleen, causing it to expand, enlarge, which then it stores more platelets, which causes less platelets to be in the blood. So that's what that means. And then there was, I don't remember what it's called, but the measurement pretty much the stuff that the liver produces that helps your bone marrow to create more platelets, that could be affected. We don't know that, but that could also be a reason why my platelet counts are continuing to drop. It could be partly because my portal hypertension causing the spleen to enlarge, to kind of like pull out or store more of the platelets that die in there. So it could also mean that my liver cirrhosis is progressing enough to where it's like I think it's like a protein or something that the liver produces or sends out that ends up in the bone marrow, because the bone marrow creates your platelets. So that's kind of like, so maybe the platelets aren't being created as much in the bone marrow, on top of the spleen is storing more platelets and pretty much killing them off. So it could be a combination of the two at this point. So, but anyway, it does say the spleen is enlarged, measuring 15.1 centimeters. But that is a decrease slightly from the October reading. Not by much. It was like 14 or 15.4. It was like a drop of like 0.1, 2, or 3, something like that. But yeah, I consider there is going to be some inconsistency with measurements each time you get an ultrasound, especially if a different person does it, or a different person also reads the ultrasound results. No, the person taking the ultrasound, no, depends on where they judge as where the liver's at, and they take points to measure it. And then it's also an interpretation of the person pretty much reading the ultrasound, seeing what it means. So, and then of course the last part of it is just my right kidney measurements, my left kidney measurements. That they're fine. It says no solid mass, no nephrolithiasis, or hydronephrosis. Hydronephrosis is when there's like a fluid buildup underneath the kidney. So I've had that a few times, a mild case of it, but it's been good the last couple of ultrasounds, so that's good. And there is no ascites, so no fluid buildup in the abdomen, which is good. Because once you go, if I had ascites, that means I'm now in decompensated liver cirrhosis, the end stage. Right now, I am in the end stage, but I'm in the compensated part of the end stage, which means yes, I have issues, but my liver is still doing what it needs to do, as far as we know, according to the blood work. So, and there says the visualized portions of the abdominal aorta and IVC are unremarkable. Pretty much says my abdominal aorta is fine. So that was the ultrasound results. So, and then this is what my liver doctor noted on here as well, and she put her feedback on here through my chart online. It's that, Sean, your ultrasound looks stable, continues to show cirrhosis and mildly enlarged spleen, but no new lesions or changes. So, but it had the blood work and the measurements, but the liver shrinking, that could be a sign of it going into decompensated. My platelet counts continue to drop. My pro time is increasing. So that could be another sign of the cirrhosis progressing. There's one other thing in there that could have been a sign. So it's like I'm just stressing out and my anxiety is going high. So, but I have to give it to my liver doctor. Like I said, that's why we talked so long. Because here's some other stuff on it. Again, this says the history of present illness. Sean Swoley, a 49-year-old male with compensated cirrhosis who presents for follow-up of liver disease and associated symptoms. Last seen in GI clinic October 2025. Okay. Cirrhosis and thrombocytopenia, which means low platelet count. That's the technical term for low platelet count. Okay, there's a bullet points under all this. It said Millet score is still 6, which is the lowest it can be, which is great. Platelet count decreased slightly from 112 to 110 over 2 weeks. That was a typo. It dropped from 110 down to 102, and it notes that later on in this. It says no epistaxis, bruising, or other bleeding symptoms. Well, that's incorrect, because I get bruises still. You kind of see the remnants of the bruise there. That's from the blood draw. Whew. That was a good one. The bruise I had over here, I think it's finally healed. I don't see it no more, but I do bruise easily, which is a sign of cirrhosis. No edema, which I agree. No diuretic use, which is true. Dark urine present. Yes, my urine is starting to get darker. Hopefully that doesn't mean there's blood in it. I have my follow-up with my urologist next month, I believe. So we'll check my urine again then. Sodium intake limited unless swelling develops per metabolic consultant guidance. So I don't have to worry about my salt intake unless I start beginning to swell up. But I am cautious about how much salt I am taking in. So, because your body needs so much salt. No, it's one of those necessary evils. You just have to try to keep it at a minimum. Okay, it says gastrointestinal bleeding and varices surveillance. The recent EGD, which is my endoscopy, showed no esophageal varices with resolution of previously noted small varices. And I confirmed that again with my liver doctors. She said, correct. Your endoscopy did not see that small varices that it had seen in the last couple of endoscopies. So that's good. But that could also mean that the blood flow that's getting backed up is taking another path, like path through my stomach, which is why my stomach looked real red blotty last time. The image, I told her the image scared me. It says, recent colonoscopy showed no polyps, which is correct, yay. After having a 3 polyp and then a 5 polyp, now have a 0 polyp, so that was always good. Hemorrhoids are intermittent and stable. No, they're not. No, they're not. She didn't even ask me about the hemorrhoids this time, so I don't know where that note's coming from. I still battle with hemorrhoids, especially with my bowel movement is either goes from loose to spaghetti-like to really clumpy and hard. And that clumpy and hard, oh god, okay. I'm not trying to gross anybody out, but oof, the hemorrhoids are still there. Sometimes they're not as big until I have a bowel movement that flares them up. Oh my god, hate that. It says no hematochezia or melena. I have no idea what that means, but it says no, so I'm okay with that. It does say here abnormal weight loss and nutritional status. It says over 50 pounds of weight loss since July. She did tell me that she is worried about my weight loss. She says according to their records, no, they weigh me when I come in to see her, I've lost 52 pounds since last July visit. So that is not good, she says. She's worried that I have muscle waste. There's a technical term for it. I don't remember it right now, but she fears that a lot of this weight loss could be a loss of muscle mass. So she's going to send a note to my metabologist consultant, which I'll see again next month for a follow-up. So, because she's going to let her know that she is concerned with that and the nutrition. But I thought that was weird because I told her, well, all my blood work that she took to see, my vitamin A, vitamin D, all that stuff, showed that it's all normal levels. But my liver doctor said that just because your blood work shows normal levels, so it makes it look like your nutrition is fine, it doesn't necessarily mean you're not malnourished. So she's going to send a message or talk with her before I see the metabologist again next week. So, but she is concerned about that. So, I'm not going to read into it except for fatigue and functional status. It says marked fatigued since thymectomy and weight loss. No, I had my thymectomy in June. I have a mostly sedentary lifestyle because I don't work no more. Uses muscle stimulator and light weights at home, which I do. I think it's working because it seems harder here, and I'm not really doing weights. I'm just doing the muscle shocker things where you put over your biceps, your abdomen, your thighs, and your calves. And it's like a shock. It shocks it, causes the muscle to move to shock it, which is causing it like it's being used. So I said I don't think I have muscle loss, but again, my liver doctor says just because you can't see it on the outside doesn't mean it's not happening on the inside. So, but yay. So, but anyway, last point of this, 28 minutes long. I'm sorry. I can't do a short video. But no, my liver doctor really stressed with me. She really tried to make a point of, you trust me. I know you trust me because you keep coming back to see me. I said, yes. She's like, then trust me to not worry, that so you don't worry about your liver right now. I can't control your other medical issues, but for your liver cirrhosis, please don't stress over it. Don't let your anxiety go overboard with this. Trust me to be the one to worry about your liver. No, I will tell you when it's time to worry, like she did with my weight loss that I've had. Now, she's a little concerned about that, and she told me, she's like, when test results come back and show that there's something to be worried about, I will let you know. Until then, she's like, live your life. Go on your cruises. Because she knows I like to cruise a lot to relax and makes me happy. So she's like, continue to do that, or whatever makes you happy, but don't think about your liver. Put that on me, she said. So she says, stay off of Google. I know you won't, she said. But I told her I am working on that with my therapist because, like, I always go to the worst case scenario. I Google a lot and I always pine on the worst case scenario on the search, even though the search will show other results that could be good. I always look towards the worst case, and that's what my mom does. So I got that from her. Thanks, Mother. But anyway, so I'm going to try to do what she says and try not to stress over it, try not to blow my anxiety up. I'm going to do my best. So anyway, that's what I got for you, folks. Y'all have a great rest of your weekend. And remember, live life to the fullest because you never know what life has in store for you. So love your family, love your friends, and just be kind to everybody, including strangers. This world needs to get better. So, all right, I love you all. Have a good one. Bye-bye.